Hello, everyone. First of all, I would like to thank the organizing community to invite us today. I will share my research about digital twin applications. Let me start my presentation with some numbers to understand why we need the digitalization in healthcare. We learned lots of things during COVID pandemic. We could not take health services for our routine health problems at the beginning of this period, but we took our health service from our home through digital health possibilities. Emergency department visit dropped dramatically for routine health problems, and it's expected that by 2014, at least 25% of the health services will move to virtual delivery. The COVID-19 pandemic has globally affected our lives and economy. Not only did significant stress national healthcare systems, but also faced up the importance of the virtual care delivery because of this. More than 80% of the global hospital CEOs state that investment in digital tools and systems have dramatically changed as a result of the pandemic. The people wants to monitor their health via digital tools. Therefore, using the telehealth is growing in the US and in also around the world. There is a reality. People are living longer. Today, the average life expectancy worldwide is 72 years. It will increase to 77 years. In developed countries, average life expectancy will probably be 81, and the people in developing countries will live to an average age of 71. This trend will increase the total aging population from 727 million in 2020 to 1.5 billion by 2015. People over 65 are expected to make up 16% of the world population by 2015. This change will cause major challenges for the world's healthcare systems. Due to the growth effect I mentioned in the previous slide, more employees or larger budgets are needed to meet the demand for the healthcare. This shortage of the qualified professionals is one of the key challenges for the industry. According to Human Resource for Health, the world will be short of 18 million healthcare workers by 2013. There are several reasons for this. The first one, a growing world population with increasing risk of chronic disease. The second one is an aging health workforce with staff retiring or leaving for better paid jobs. Third one, too few young people entering the profession and lack of the adequate training. The last one is internal and international migration of the health workers. The burden of chronic disease is rapidly increasing worldwide. It has been calculated that in 2001, chronic disease contributed approximately 46% of the global burden of disease. The proportion of the burden of chronic disease was expected to increase to 16% by 2020. To reduce the impact of chronic disease, we have to use the digital solution properly. We see that on previous slide, we will face up high demand for the health service because of the population growth, the aging, and the number of healthcare persons. To solve these problems properly, we can use the digital health possibilities. What is the digital health? Digital health connects and empowers people and population to manage health and wellness augmented by accessible and supportive provider teams working within flexible, integrated, and digital-enabled care environments that strategically leverage digital tools, technologies, and services to transform care delivery. The health system of the future will focus on the outcomes of the individual and build a digital ecosystems that provides care when, where, and how they need it safely and securely. We are using technologies for now like mobile health, telemedicine, telehealth, wearable devices, and so on. Lots of companies trying to develop digital health application to be part of the next generation of the healthcare systems. On the other hand, there are ongoing academic works on this area. Through Industry 4.0 components like AI, big data, IoT, and etc., the healthcare application can monitor our health parameters easily and detect the anomalies to prevent health problems. These are two academic works related to digital health application. The first one is the remote follow-up system for the chronic disease to reduce the cost of disease management and control the hospital capacity. And the second one is an anomaly detection system for cardiac problems via smartwatches. And what kind of technologies are behind the digital health? We are using the most Industry 4.0 components in digital health applications. We need the sensors to collect the necessary data and IoT device to transfer this data to the cloud, which stores the data. And to process this collected data, we need the AI and the big data technologies. To create secure data communication, we have to use blockchain and the cybersecurity technologies. Another important technology for digital healthcare is the digital twin. I will give more details about it in the upcoming slides. I have said that data is the basis of the digitalization in health. It's estimated that 1 trillion sensors were worked in the world in 2020. In 2021, each person produced 15 terabytes of data. Every data produced by people is very important for health, and it's of great importance in the digital management of health. Because of the data usage of the healthcare system, AI is one of the important technology to develop features of the digital health. In the healthcare field, 138 AI algorithms have already been approved by the FDA as the healthcare applications. We can manage our chronic disease like a diabetes and cancer with support of AI algorithms. What is the digital twin? It's a real-time digital profile of the past and current behavior of the physical object or process that help optimize the business performance. To make a clearer definition, it's a virtual copy of a physical object. The first definition in the literature were put forward by Dr. Michel Greaves from Michigan University in 2002, and the conceptual model was presented in 2006. In 2010, it was made available as a digital twin in the NASA technology roadmap. There are lots of digital twin application usage in healthcare sector. The most important one is the patient care. Support of this application, we can manage the chronic disease and easily and efficiently. And we can manage the healthcare facility and try to new development on digital copy of the facility to increase the efficiency and the facility. Another application area is training and education. We can use the digital twin of the hospital and the medical device to train our health workers without any risk and the cost. We can develop new drug and treatment technique via digital twin of human. In this case, we will not take any risk and spend a few money for this process. You can see some digital twin application in healthcare on the slide, like a patient remote monitoring, surgery planning, medical device development, and hospital operations. And this is the use case of the digital twin. The hospital, which has a capacity and management problems in the field of medical imaging, has provided savings and improvements in many areas by analyzing and rearranging its business process with the digital twin technologies. After this process, the hospital reaches the shorter wait times, faster patient turnaround, increase the equipment utilization, and the lower staffing cost. This is one of the digital twin concepts which was developed by the Siemens Healthineers for the people who has cardiac disease risk. The aim of this concept is collect and monitor all related health and life data of the people to prevent his cardiac health problem risk. To do true analyze, we have to collect real-time all related data and the process with this AI-based algorithm to see anomalies. People coffee consume amount data will affect this type of algorithms. Therefore, we have to collect this data from smart coffee device also. As with any new technology, digital twin technology presents some challenges. Although most of the challenges identified are technical, some challenges come from regulation and the culture. While it may be easier to overcome technical challenges, getting people to use this technology is a bigger challenge. Regulation are standard problems that affect all the new technologies. Let me finish my presentation with a short video from the Siemens Healthineers about the future of the health. Thanks for the listening.
In the decades ahead, healthcare will undergo dramatic transformations. Medicine will become more precise. Value will shape care delivery. Patients will become empowered consumers. And digitalization will transform every facet of healthcare. Patients will have a digital twin, a customized computational model of themselves, enabling Dr. Clive to anticipate illness, guide therapy options, and predict outcomes of procedures. Expanding precision medicine will enable radiologists to make highly specific diagnoses for Stephen without unwarranted variations. AI-powered decision models, fed by vast population health data, will improve diagnostic accuracy. Healthcare will become anticipatory, organized around Paula's medical conditions, and available around the clock, transforming care delivery. Multidisciplinary, highly productive care teams structured around patients and their needs will collaboratively deliver the full cycle of care. All interactions with John will become convenient, personalized, and compassionate, improving patient experience. Supported by real-time monitoring and guidance, John will become more empowered and have physical and virtual access to care when and where he needs it. At Siemens Healthineers, we are enabling healthcare providers to increase value, shaping the future of healthcare.